Our next presenter is going to continue on, I guess, not from a diet perspective, but other things we can do to help our liver. So this is Dr. Hodge. So Dr. Hodge completed his PhD in 2015, focusing on stem cell therapy for liver cirrhosis and lifestyle modifications for fatty liver, but also has extensive experience working with PSC patients and understands that while we are limited in PSC treatments, there are lifestyle choices we can make to reduce liver strain. So he works across the Eastern Health Network in private practice, as well as being a lecturer at Monash University. He has a knack of talking the scientific to the practical, and he might be familiar to some of you who came to our forum, I think it was in 2019, because he presented there as well. So thank you, Dr. Hodge, for giving your time up again to present to us, and I'll hand over to you.
So thank you guys again. Thanks PSC Support for giving me the opportunity to have a chat today. Now, Travis, I will correct you a little bit. I'm going to actually talk a little bit about diet as well, because when we do talk about liver health, there's let's be honest, it is a lot about diet. So let me just see. There's the slides. Move on. Okay, so I guess the first question is, well, what let's define health. What is health? So if you look at the Oxford English Dictionary, this indicates that health is the state of absence of illness or injury, okay? So the definition in the World Health Organization is a little bit more complex. It's the definition to them states that it's a complete physical, mental, and social well-being, not merely the absence of disease or infirmary. So it doesn't say you have to have the absence of disease, but it's this holistic sort of approach to the physical, the mental, and the social well-being for one's so-called health. So what does this mean for liver health? Okay, so we'll get to it in a moment. So first of all, I'd like to tell a story because we all like a good story. And so this is a story of Mr. A.R. He's a 67-year-old gentleman, very intelligent man. He actually retired at the age of 35 after he was he developed some sort of patent in the fencing industry, something to sort of hold posts in place. I don't remember exactly what it was. But anyways, he retired and joined the World Series of Poker, believe it or not. So he was one of these guys that you used to see on television. He called himself single and living large. He was not only living large, he was rather large. He was obese. He also had metabolic syndrome, and he had fatty liver and mildly elevated liver enzymes, which is the reason why I saw him. So he spent 6 months overseas, 6 months in Australia. He, when he was over there, he called it working the night shifts, which essentially was playing poker all night. And to do this, he consumed a significant amount of caffeine. And well, it wasn't so much the caffeine, it was really the high sugar content in these beverages that he was consuming. And then, of course, during the day, when he did eat, it was unfortunately some pretty rubbish American food. So he was, as I mentioned, he was obese, he was large, he had some mildly elevated liver enzymes. He wasn't diabetic, although really he was heading that way. So we did a number of tests, and those of you familiar with the FibroScan is basically a non-invasive test that measures the stiffness of one's liver, which gives us some idea of how much scarring or liver damage is there. And that's 66.4, that's high, that's really high. I went on to do a biopsy, and indeed, you can see there, fibrosis 4, that's stage 4, that's cirrhosis. And in fact, this is a piece of his liver right there. And you can see, I don't know if the cursor, there's cursor there. You can see these large bands of collagen. This is a cirrhotic liver. So huge bands of collagen, lots of inflammatory infiltrate, and there's little bits of fat there. But that's not a healthy liver. So I tried to convince him to see his GP. He said, "Oh yeah, look, I think I'll do that." I said, "You need to see a dietitian, you need to exercise." And he said, "Well, look, I'm just going to take a pill. So just prescribe that to me." Well, it doesn't really work that way, I told him. So over the period of a number of months, maybe it was about a year, he went in and out of recognition of his health issues. There was periods where he would adhere to guidance, and other periods where he just sort of disappeared into the poker scene. Unfortunately, 12 months after that, so almost 2 years after I first saw him, he was admitted to hospital with diabetic ketoacidosis. So that was kind of the turning point. He stopped playing poker, decided to teach poker instead, was committed to see a dietitian, endocrinologist, you name it, and then tried really hard to follow the advice of the health professionals, although, although really he still wanted a pill. So he did make changes to his diet. He regained weight. He tried various diets, did a bit of exercise, but although this was quite limited. And it did appear he was starting to commit to change, but he really found it difficult to sustain that implementation. So unfortunately, he developed portal hypertension. His platelets dropped, and I had to get a gastroscopy to look for varices. So could he have avoided these liver issues by maintaining good health or striving for better health? Because really, this is a gentleman that had a lifestyle that was just not only not healthy, but it also contributed significantly to the progression of his disease. So is there anything he could have done to turn the ship around, or, as I said, maintain better health? So what is health? So when we think of maintaining health, we think of two main concepts, at least or I do. That's how I kind of had to think about this for the talk, is that there's the medical intervention, which is the one on this side here. So this is the tablets you pop, basically, the pills you take, the treatments you undergo. And then there's this whole aspect over here, which is really what can you do for yourself? And this is really what we're talking about. That's lifestyle related. Okay, so I'm going to focus more on that aspect and what we can do for ourselves and for our livers. So how do we keep a liver healthy? So what can we do for our livers? More specifically, as I said, what can we do to keep our livers healthy and free from illness or injury? So yeah, what can we do? That's the same slide. What can we do from keeping our livers from becoming unwell? And what is in our control? Are there things that we can do? And maybe there are things that we simply can't do. So if we're talking about PSC, unfortunately, there's nothing in our control per se which can keep us from developing it or from developing its progression. But I guess if you step back and ask yourself, what is actually an unhealthy liver? Well, we're talking about a liver that has sort of liver cirrhosis, right? And cirrhosis is the potential end result of all types of liver disease. Ones that some you can control, some that you really can't. So, in terms of hepatitis B and C and those viruses, well, it's trying not to get them, or if you get them, treat them. Wilson's disease, it's more of a genetic copper deposition issue. Again, you can't really do a lot to control that. So there's not a lot of lifestyle that you can change to implement these conditions. And so that's the same for most liver diseases. However, not all types of liver conditions that pertains to. So there's one type of liver condition which we do have some control over. In fact, it's the most common liver condition. And that is, as you probably guessed, is fatty liver. So there is the main liver disease, which is essentially, there's genetics involved and other features, but it is essentially, a lifestyle-driven disease. So that is something that we have a control over. But I guess one of the good things, if you want to call it good, or I guess one of the things with PSC, though, is you think, okay, well, if I have PSC, am I going to get fatty liver on top of PSC? Is that possible? Well, it is, and that's what you do have some control over. But actually, studies suggest that PSC is actually protective against fatty liver. In fact, I think this particular study suggests there's about a 50% reduction in risk reduction in developing fatty liver if one actually has PSC, in particular those people who have PSC and have IBD. But so let's just take a step back. Okay, so if we're talking about a condition of the liver that we can prevent, it's common. How common is it? Well, in those people who are obese, it's about 80%. The global prevalence, depending on the study you look at, is about 25 to 30%. So almost a third of the world has fat in the liver. So that's pretty darn common. I'll just skip over this slide. Sorry. This basically just shows that lots of people in Australia, but not only in Australia, is overseas are overweight. It's a real health and public health problem. So what is actually fatty liver and how does it get there? So the pathophysiology of fatty liver is quite complex, lots of factors involved, as you're probably not surprised to hear. It's mainly characterized by the accumulation of lipids in the obviously the liver. Three main pathways. Pathway number one, excessive influx of fatty acid from endogenous fat, basically, adipose, and visceral fat, caused by excess dietary fats. And probably the most important one is the one that we talk about the most, is this de novo lipogenesis, and that's the actual liver creating fat from carbohydrates, okay? And the fat in the liver develops when the hepatic fatty acid concentration accumulation exceeds the liver's ability to kind of get rid of that, okay? So that's in simple terms. So what is the best sort of lifestyle for one's liver? Well, lifestyle, again, what does that include? That's diet, that's exercise. Are we talking about weight loss when we talk about diet? Maybe, maybe not, depending on the individual. So just keep that in mind. But if you look at the studies of fatty liver, how do you get rid of liver fat? Well, I mean, they pretty much focus on weight, okay? So when you look at fatty liver studies, I'll just be honest, they do look at weight loss. And so weight loss does essentially result in liver fat loss. So if you look at this here, 5% weight loss, you lose fat, but no impact on inflammation or fibrosis. The more weight loss that you lose, the more weight you lose, the more not only fat you lose, inflammation, and also fibrosis. But you don't necessarily have to lose weight, and in particular, for a lot of people who have PSC, you don't want to lose weight. So you just have to, just keep that in mind. So as I said, if we're talking about fatty liver, we're talking about weight loss. No, sometimes you don't want to lose weight. Does the type of weight loss or how fast you lose it matter? Sometimes it does, sometimes it doesn't. Surprisingly, a lot of early studies looking at sort of very low calorie diets actually made the liver worse. And actually, some of these low carbohydrate, high fat ketogenic diets actually also induced metabolic issues. So, not all diets are necessarily equal. And certainly some of these calorie restrictive diets are not necessarily healthy. And probably low calories or calories and macronutrient distributions are probably both important to facilitate hepatic fat loss and hepatic inflammation improvements. Although, as I said, very low calorie diets may drive weight loss, it may not be safe for normal weight or underweight people who have PSC. And in fact, higher caloric content diets, particularly looking at macronutrient distribution, may actually have a positive benefit independent of weight loss. So if you look at all the different types of diets, which ones are best? Look, there's a whole myriad of diets which are supposed to be so-called healthy. They essentially all be pretty much very similar. They're saying, you should eat food, a lot of plants, mostly plant-based, and lots of healthy protein. But if you looked, I guess, at the diet when it comes to fatty liver and metabolic syndrome, the one that has sort of the most research on, that's really the Mediterranean diet. What is it? Well, there's no strict definition of what constitutes a Mediterranean diet, but it really much dates back to patterns that people in the Mediterranean region would have employed throughout history. Has many variations. Olive oil is the principal source of fat, and about 35 to 45% of the total energy, intake is actually olive oil. Salt intake is also reduced. It's replaced by things like herbs and spices. You need a lot of water, adequate water, and protein is very important here, lean protein. So if you look at the Mediterranean diet and step back and go, okay, is it good for not only the liver, but for general health? And yeah, it's pretty good. It's associated with a whole lot of positive health benefits. It reduces all-cause mortality. It's reduced rates of cardiovascular disease, particularly reduction in fatal and non-fatal myocardial infarctions, reduction in hypertension, dyslipidemia, improves metabolic outcomes in people with diabetes and metabolic syndrome, lower rates of diabetes and better sugar control in people with diabetes, lower rates of age-related cognitive decline, such as neurodegenerative disorders, particularly things like Alzheimer's disease, reduced incidence of cancers, and it tends to result in weight loss and reduce waist circumference when energy restricted. However, you don't have to lose, as I said, lose weight to lose liver fat if you're on a Mediterranean diet. So it is the most recommended diet for people with fatty liver. There's a lot of thoughts about this. There's a lot of antioxidants and anti-inflammatory properties of the diet, which they think may counteract, at least in lab settings, counteracts reactive oxygen species that may drive inflammation of fatty liver, and maybe also in PSC, although not entirely clear. And then these added benefits, as I mentioned, of the cardiovascular disease, the cancers, the insulin sensitivity, all-cause mortality. So overall, it's a pretty healthy diet. And as I said, you don't have to lose weight. And this particular study looked at comparing the Mediterranean diet with another type of sort of what they call the alternate healthy eating index, which is this AHEI. And they found that people who were on the Mediterranean diet actually lost liver fat, even though their BMI actually increased. Okay, so they, as I said, it just reinforces that notion you don't have to lose weight to lose liver fat if you're on this type of diet. Generally, in fatty liver, again, red meat tends to not be advised due to the increased incidence of insulin resistance. However, I think it's very important to stress, never reduce protein to reduce calories, okay? You need protein in every meal. In fact, there's more and more evidence that it's protein. Keep having protein. How about alcohol? So, look, there's a switch. If you're looking at, again, liver health, there's a switch from telling people that small amounts are okay, particularly if you've got any metabolic issues now, to saying really the safest amount is actually 0. Alcohol use is a leading risk factor for global disease burden. So even small amounts may increase all-cause mortality and cancer. So it's hard to really say any amount of alcohol is safe, although that's not to say I don't occasionally have some alcohol. Now, my favorite topic, coffee. So coffee is a good thing for the liver, or at least equivocal, but I assert that it's actually good. So in fact, I dare you to find a study that says coffee has a negative impact on your liver. So coffee lowers liver enzymes, there's reduced risk of various cancers, but we're focusing on the liver today, so reduced risk of hepatocellular carcinoma. When you look at fatty liver, excuse me, there's less liver steatosis, less liver fat in people who drink coffee. There's my sip of coffee. Less fibrosis, possibly. So that's fatty liver. But okay, what about PSC? So, look, there were 2 studies in 2014 which may shed some light on this. Essentially, what the take-home message from these 2 studies is that PSC is more likely. PSC is more likely, maybe more common in people who don't drink coffee or have never drunk coffee. So, is coffee protective? So, this one particular study, 480 people with PSC, 600 patients with PBC, which is primary biliary cholangitis, and a bunch of controls. And they found that people who have PSC, 24% of them never drunk coffee compared to 16% of control. So they're saying coffee consumption was lower in people with PSC, so maybe coffee is protected, maybe. How about coffee and smoking? Well, this study showed that there's a lower proportion of people who have PSC were also coffee drinkers compared to controls. So there were more people who were the control patients who were drinking coffee. Also, the controls tended to smoke more. So this was suggesting that maybe coffee and cigarette smoking is protective. I would probably not necessarily follow that advice, but at the very least, even if you say that, look, these studies were a bit kind of wishy-washy, they certainly didn't suggest that coffee was a bad thing in PSC. So switching tacks, so we talked about sort of diet. What about exercise? Well, what about exercise without diet? There's meta-analysis a few years back looked at about 30 different studies, and they said essentially, even if you do nothing to change your diet and you have a rubbish diet, physical activity, independent of any change in weight, was actually associated with decreased liver fat and improvement in liver enzymes. So now we'll move on to sort of more special cases. So look, what if you're underweight? Well, you don't want to lose weight. You actually want to either gain weight or at least maintain your weight. So, smaller, more frequent meals, snacks, more calories, not less calories. And you may need nutritional supplementation, okay? What about in the case of cholestasis, when you have elevated bilirubin? Well, you may actually also have elevated cholesterol, but it's not because of the fact it's not a cardiovascular risk. It's the fact that because you've got impaired bile cycling. So you don't reduce fats or start a statin. In fact, you may actually have fat-soluble vitamin deficiencies. So you may actually have to take supplements. Also, because of the steatorrhea and the fat-soluble vitamin deficiencies, you may have deficiency in vitamin D. You may have low bone mineral density, which also may be compounded by having decreased muscle mass. So, you certainly don't want to reduce calories, and you absolutely don't want to reduce protein or necessarily fats in this instance as well. What about some natural products? You'll probably see things like milk thistle or silymarin spoke about. Look, it's a plant-derived product. It's safe to take, but it really doesn't have a clear benefit in reducing fibrosis. This is an interesting one, which I've seen. I don't know if you've come across this resvis. I can't even say it properly, but it's a natural product found in the skin of red grapes, or grapes in general. It's actually a natural FXR agonist, and there is some evidence that FSR agonists may actually be therapeutic agents in PSC, and there's a trial recently, phase 2 trial looking at that. So this particular natural occurring product does activate FXR and may be a potential therapeutic agent, although I'll be honest, the amount that you get in this particular natural variation is probably far less than you would in the drug that they're making. So in summary, look, I think it's important to eat lots of vegetables, lots of protein. I can't stress the protein enough. Mediterranean diet, I think, is a pretty safe bet for an overall healthy liver diet and overall general healthy diet, but you need to tailor it to yourself, and certainly along with your dietitian, you need to tailor the diet that suits you. Coffee, yeah, you think you should drink coffee. And you always, these special cases, if you're underweight, if you've got cholestasis, vitamin deficiencies, and also your bone health is important. So I'd like to thank you for listening, and hope you got something out of it. And there's the happy liver after coffee.